And I'd like to come back on that issue of taxation. Concerns about inter-county tax for those who are transporting their produce across county borders. Some argue, why should I pay tax? You said the small business people should not close their businesses when the county askaris come to collect revenue. Some would argue, why should I pay for services I don't receive? But we'll get into that. Dr. Gitau, which counties have done, because this is a third electoral cycle, this is the third time we are seeing governors take their oaths of office since the constitution was promulgated in 2010. The first election after that was in 2013. Which counties have been performing well?
So I would say in terms of performance, majority of the counties...
In healthcare?
Yeah, in healthcare. Majority of the counties definitely have made steps in the right direction. Of course, there are those who stand out, such as Makueni, who's been able to actually improve access to services to their people. You have places like Kisumu, who've actually improved the community health strategy. So you have a lot of the northern frontier counties who've actually, for the first time, been able to actually take some service provision to actually the people and actually have doctors in these particular areas. So indeed, without mentioning specific counties, we can say there are those counties which were more favorable in terms of improving access. But on the whole spectrum, we can just say is that in terms of infrastructure, there was a lot of work that was done by the previous governors. So right now, I would say in terms of the counties who've not been treating health workers very well, and indeed some of the county governors who lost, and you would see health workers celebrating because pretty much they were mistreated in the counties. For instance, just to mention Laikipia, I think some of the health workers were sacked 3 years ago, and I think the new governor has come in and they said we are going to reinstate these people. So what the governors pretty much in terms of the health service, what we are looking for in terms of the new governors. One, are we able to keep our health workers? Are we able to ensure sustainable health products available to everyone in Kenya? And in terms of the efficiency of service provision, we want you not to travel to come to Nairobi for a mammography. Are county governments able to do that? And delays in service provision. Sometimes we have a lot of push and pull either within health workers or even lack of drugs in the facilities due to certain delays either in budgeting, certain delays in approval, and it actually influences the health of the people.
Okay. Yeah. And Kirinyaga County is another one. I think when Anne Waiguru was before Senate, some health workers testified for her removal from office, and that has been a long-standing dispute.
And I hope during her second term, I think she has a huge burden in terms of ensuring that the challenges that she had in her first term with health workers and even just pushing the health agenda, we do hope during this second term there'll be more harmony. I think she had a meeting with health workers just before her re-election, and I do hope the promises which she gave to healthcare workers and even in terms of improving health services within Kirinyaga, she'll be keeping them.
All right.